Hello everyone, and welcome back to my channel. I'm your host, Healthy Doctor, a physician who's been on the front lines of healthcare for over 6 decades, witnessing firsthand the evolving landscape of health, especially for our senior community. Today we're diving into a topic that causes a great deal of concern for so many: high blood sugar. It's a subject that can feel overwhelming, especially when you're just starting to notice those numbers ticking upwards. You might be thinking, am I already a diabetic? Am I heading down a dangerous road? It's a valid question, and one I hear often in my practice. But here's something crucial to understand. Not all high blood sugar readings automatically mean you have diabetes. And perhaps even more importantly, not every little feeling of discomfort after a meal is necessarily a sign that things are falling apart. Today, I want to share with you a simple yet powerful set of indicators. These aren't found on a lab report. They're cues your own body is giving you. If you experience none of the following 4 post-Dan meal symptoms, it's a very strong sign that your blood sugar levels are being managed beautifully, perhaps even better than any test result can tell you. Let me paint you a picture with a real Dan life case that really hit home. Just recently, I had a Zhang, a spry 70-year-old gentleman, who started feeling, well, not quite right after meals. He's generally a healthy fellow, enjoys his routine, but lately something felt off. One afternoon, he and his wife were having a simple lunch at home, just a bowl of rice. Less than an hour after finishing, Mr. Zhang suddenly felt a wave of dizziness wash over him, accompanied by a profound sense of fatigue. Then came the dry mouth, that nagging thirst that just wouldn't quit, followed by not 1, but 2 urgent trips to the restroom. He ended up practically collapsing onto the sofa, breaking out in a cold sweat. His wife understandably panicked, initially thought maybe he'd had a touch of heat stroke, or perhaps a dip in blood pressure. They rushed him to the hospital. After a preliminary examination, the doctors ruled out any immediate acute issues like heat stroke or low blood pressure. However, they suggested his symptoms were eerily indicative of something called blood sugar dysregulation, and recommended he come back first thing the next morning for some fasting blood work. So, the next morning, Mr. Zhang was back at the hospital right on time for his tests. This time, the doctors initiated their standard comprehensive blood sugar monitoring protocol. They drew his blood on an empty stomach, and then again 1 hour after he ate a standard clinic breakfast. The goal was to get a full picture of how his blood sugar was behaving before and after a meal. By lunchtime, the lab reports were ready. That afternoon, Mr. Zhang returned to my office, report in hand. As I reviewed his lab results, I couldn't help but furrow my brow a little. His fasting blood sugar was 0.4 millimoles per liter. Now, that's on the higher side of normal, but not yet officially in diabetic territory. However, his blood sugar 1 hour after breakfast had soared to over 0.6 millimoles per liter. While this reading by itself didn't definitively meet the diagnostic criteria for diabetes, it was a very clear alarm bell. It signaled that his body's ability to regulate blood sugar was compromised. He was what we call a high GAN risk individual for progressing into type 2 diabetes. Mr. Zhang looked at me, genuinely bewildered. "Doctor," he said, "I don't even eat a lot of sweets. My meals are pretty regular. How can my sugar be this high?" I then went over his lifestyle questionnaire with him, asking specific questions about his daily habits. I inquired about his post-Dan meal routine. Do you tend to sit down right after eating? What about during dinner? Are you conscious of how much refined carbohydrate you're eating, like white rice or white bread? Do you find yourself eating plenty of vegetables? Mr. Zhang nodded in agreement with some of these points, admitting he often sat right after eating and probably didn't prioritize vegetables as much as he should. I explained to him that these habits, while seemingly minor, can indeed cause significant fluctuations in blood sugar after meals. He sighed, then added something very important. "Doctor, my body has been sending me signals, you know. That feeling of dizziness after eating, the fatigue, the dry mouth, the feeling of being constantly hungry. I thought it was just me getting older. I didn't realize it was the body's way of sounding an alarm about my blood sugar control." This is a critical insight, folks. Your body's feelings after a meal are often a more reliable, real-time indicator of your blood sugar regulation than the numbers on a lab report alone. So what are these vital signs that tell you your blood sugar is likely stable and well managed? We often hear the saying, "It is not just about what you eat, but how well your body digests it." But I'd argue it goes a step further. It is about how your body feels and reacts in the hours following a meal. These post-jan meal responses are the true, unfiltered revelations of your blood sugar control. If you can honestly say you don't experience the following 4 common issues after eating, then congratulations. Your blood sugar is probably humming along nicely. First, you don't feel drowsy or excessively fatigued immediately after eating. Many people, perhaps you included, feel that familiar wave of drowsiness wash over them after a meal. That feeling where your eyelids get heavy and you just want to curl up for a nap. You might blame it on eating too much, or perhaps just a heavy meal. But very often, this post-jan meal sleepiness is a direct result of your blood sugar spiking too quickly. When your blood sugar surges rapidly, it can actually suppress the brain systems responsible for keeping you alert, essentially triggering an immediate power-off mode. However, if you finish your meal and you still feel energetic, alert, and free from that heavy jan-lidded feeling, it indicates that your blood sugar levels are remaining relatively stable and your body is maintaining its equilibrium. This is a fantastic sign. Second, you don't experience excessive thirst or an urge to drink large amounts of water. This one is a classic. If shortly after finishing your meal, you suddenly find yourself feeling parched, with a dry, almost scratchy mouth, reaching for glass after glass of water, it can be a very strong indicator of high blood sugar. When your blood sugar is excessively high, your kidneys work overtime to try and flush out that excess sugar. In doing so, they pull more water from your body through the urine, leading to dehydration, and consequently, that intense thirst. If, on the other hand, you finish your meal and you don't feel that overwhelming urge to drink, your mouth feels comfortably moist, and you don't feel unduly thirsty, it's that your body is maintaining adequate hydration, and your blood sugar hasn't surged to a point where it's significantly impacting your fluid balance. Third, you don't feel an urgent need to visit the restroom frequently. This ties directly into the previous point. High blood sugar puts your kidneys into overdrive, functioning like a tireless, overloaded machine, trying desperately to eliminate the excess sugar from your bloodstream. This overwork leads to increased urine production, and that translates into frequent trips to the bathroom. Often urgently so. But if you eat your meal and you feel perfectly normal, not needing to make frequent trips to the restroom in the immediate aftermath, it is a really good sign. It means your blood sugar levels aren't exceeding the kidney's capacity to manage them efficiently, and your renal system isn't being put under unnecessary duress. Fourth, you can comfortably reach your next meal without feeling unmanageably hungry. This is a subtle but incredibly important indicator. If you eat a meal and then find yourself feeling ravenously hungry again in what seems like no time at all, it is often not because you have a huge appetite. Instead, it's a sign that your blood sugar has likely experienced a roller coaster effect. It might have spiked quickly after your meal, giving you that brief energy surge, but then it crashed just as rapidly, leaving your body, and specifically your brain, to misinterpret that dip as a lack of sustenance. This triggers an urgent hunger signal. However, if you can eat your meal and feel comfortably satisfied until your next scheduled mealtime, without experiencing that premature, overwhelming hunger, it tells us your blood sugar is likely operating on a much more stable, steady track. So, to summarize these crucial points, after you eat, do you feel alert or drowsy? Are you uncomfortably thirsty, or is your mouth comfortably moist? Do you need to rush to the restroom frequently, or are your trips to the restroom normal? And can you comfortably wait until your next meal, or do you experience intense hunger soon after eating? If you can honestly say you don't have any of those post-meal discomforts, then your body is giving you a stronger, more reliable message about your blood sugar control than any lab report. It's telling you loud and clear that your system is stable. Now, I understand that seeing a blood sugar reading that's higher than you're used to can be frightening. Many people immediately jump to the conclusion that they must have diabetes. But it's important to remember that our bodies are complex systems. And sometimes, blood sugar can rise temporarily due to various factors, without necessarily indicating a chronic condition like diabetes. As Professor Xu Gugan of the Second People's Hospital of Guangdong Province pointed out, some instances of elevated blood sugar can be what we call transient stress responses. These are temporary, and your body can actually return to normal levels within days without any intervention. What kind of situations can cause these temporary spikes? Think about when your body is under significant stress. This could be due to a fever, an infection, a physical injury, surgery, intense physical exertion, or even severe emotional stress or nervousness. Certain medications can also play a role. Drugs like corticosteroids, some diuretics, or oral contraceptives, for example, can trigger your body to release a surge of stress hormones, which in turn can temporarily push your blood sugar levels higher. These types of elevations are generally temporary and reversible. Once the stressor is removed, or your body recovers, your blood sugar levels usually normalize. So a single high reading doesn't automatically equate to a diabetes diagnosis. Don't be too quick to label yourself. So what truly defines diabetes, according to the experts? The World Health Organization, WHO, and the American Diabetes Association, ADA, have established clear diagnostic criteria. You can be diagnosed with diabetes if you meet any of the following: a fasting blood sugar of 7 millimoles per liter, or higher, a 2-hour blood sugar reading after a meal of 7 millimoles per liter, or higher, or a random blood sugar reading of 7 millimoles per liter or higher, especially if it is accompanied by the classic symptoms of diabetes Fe, something we call the 3+1, increased thirst, polydipsia, frequent urination, polyuria, increased hunger, polyphagia, and unintended weight loss. In some cases, a test called hemoglobin AOC, or HbA1c, which reflects your average blood sugar over the past 2 to 3 months, being 5 or higher, also indicates diabetes. If you don't have those typical 3+1 symptoms, doctors will often recommend repeating the test to confirm before making a formal diagnosis. Then there's a critical intermediate stage that we absolutely must pay attention to: prediabetes. This is a tipping point where your blood sugar levels are higher than normal, but not yet high enough to be diagnosed as full-blown diabetes. In this stage, your body's insulin function is starting to falter, and your pancreas is beginning to struggle with the demands. The criteria for prediabetes are typically a fasting blood sugar between 2 and 2.9 millimoles per liter, or a 2-hour post-meal blood sugar between 7 and 7 millimoles per liter. Your HbA1c might be between 5 and 5. While it's not a diabetes diagnosis yet, it's like a warning light flashing on your dashboard. Studies show that without intervention, a significant number of people with prediabetes will progress to type 2 diabetes within a few years. The good news, however, is that for people in the prediabetes stage, there is often a very real opportunity to reverse the trend. Mr. Zhang, for instance, with his fasting blood sugar of 2 and a post-Dan meal spike to overshe, was told by his doctor that he was in the prediabetes category. He wasn't prescribed medication, but the message was clear. Lifestyle adjustments were non-negotiable. If he didn't change his habits, the next step would be a diabetes diagnosis. This is a crucial window of opportunity. Research overwhelmingly supports that through scientific dietary changes, increasing physical activity like walking, losing even a modest amount of weight if needed, and maintaining a regular sleep schedule. Individuals with prediabetes can often reverse their condition and return their blood sugar levels to a healthy, normal range. So, the key takeaway here is, if you find your blood sugar is elevated, don't panic. Understand the context. Is it a temporary stress response, or are you in the prediabetic stage? The crucial point is to act now, while you still have the power to reverse it. Taking control during the prediabetic phase is the most responsible and beneficial thing you can do for your future health. So, how do we eat for better blood sugar control? Because let me tell you, relying solely on medication isn't enough. If your diet isn't supporting your efforts, all that medication can be like trying to bail out a sinking boat with a leaky bucket. These 4 dietary strategies are essential. If you can implement them consistently, you will see your blood sugar levels stabilize. First, be smart about your starches. Carbohydrate control is key. Many people tell me, "Doctor, I've cut out all sweets, but my blood sugar is still high." The problem often lies not just with sugar, but with the sheer volume of refined carbohydrates. Think white rice, white bread, standard pasta. These are rapidly digested and can send your blood sugar soaring. The recommendation from doctors is generally to control your total daily intake of starchy foods, aiming for roughly arginine to 70 grams, depending on your individual body size and activity level. But it's not just about the quantity, it's about the quality. Don't just stick to white rice and white bread. Mix them up. Incorporate whole grains like oats, barley, quinoa, and even things like cornmeal or a handful of lentils or split peas into your meals. These provide more fiber, which makes them more filling and crucially slows down the absorption of sugar into your bloodstream. They act like a brake on how quickly your blood sugar rises. Remember, the goal isn't to eliminate carbohydrates entirely, They are your body's primary fuel source, but to choose them wisely and eat them in a balanced way. Second, front-end load your fiber. Eat your vegetables first. The order in which you eat your food can actually make a significant difference to your blood sugar response. Research has shown quite compellingly that starting your meal with vegetables before you even touch your starches or proteins can lead to a noticeably lower peak in your blood sugar levels. Why does this happen? Those marvelous vegetables are packed with dietary fiber. Fiber acts as a sort of natural dam, slowing down the rate at which sugars from the rest of your meal are absorbed into your bloodstream. Think of it like putting an early traffic light on the sugar highway. So my advice before you dive into your main course, start with a generous serving of non-starchy vegetables. A simple side of steamed greens, a fresh salad, or even some raw carrots or cucumber slices can make a world of difference. Third, get moving after your meal. Gentle activity is powerful. This is a habit that many people, especially seniors who might feel tired after eating, unfortunately skip. You finish your meal, the comfortable chair beckons, and you settle in for some screen time, watching TV, scrolling through your phone. This is precisely the time when your blood sugar is most likely to peak. And by sitting still, you're essentially giving it free rein to run wild. However, a simple, gentle act like moving around can make an enormous difference. Getting up and walking for just 15 to 20 minutes after your meal can significantly help your body utilize some of that glucose. Think about simple tasks: clearing the table, washing the dishes, going for a short stroll around the block, or even just walking around your living room. This light activity helps your muscles absorb some of that circulating sugar, effectively helping to bring your blood sugar levels down to a more stable range. It's not about strenuous exercise, just gentle movement. It makes you feel better afterward too, less sluggish, more energized. Fourth, medication is important, but always follow your doctor's guidance. If you've been diagnosed with diabetes or even prediabetes and your doctor has prescribed medication, it's vital to adhere to their recommendations. Medications designed to manage post-GAN meal blood sugar peaks, such as certain classes like meglutinides, DPP-4 inhibitors, or alpha-GAN glucosidase inhibitors, can be very effective. They work by influencing how your body processes or absorbs sugar after you eat. However, and this is a critical point, you must never self-GAN medicate or simply follow what someone else is doing. These medications require precise dosing and careful consideration of your individual health profile. Always discuss your treatment plan with your doctor. They can ensure you're on the safest and most effective regimen for your specific needs. In essence, controlling your blood sugar truly starts with the simple, everyday act of eating. Eating the right foods, eating them in the right order, and moving a little after you eat. These are all powerful weapons in your arsenal. Master these meals of healthy habits, and you'll win the battle for stable blood sugar. Let me share a story about a young man named Xiao Li. Xiao Li is a Senshitsi Jan-old office worker. Like many of us in sedentary jobs, he spends his entire day glued to a computer screen. His work is demanding, he faces a lot of stress, and his eating habits are inconsistent. Initially, he just noticed always feeling sleepy after lunch, experiencing excessive thirst that required constant refills of his water bottle, and frequent bathroom trips in the afternoon. He brushed it off, thinking, "Oh, I'm just tired," or maybe it is a bit of kidney weakness. He didn't connect it to his blood sugar. Then came his company's annual health check Jan Up. The report delivered a shock. His fasting blood sugar was limoles per liter, and his HbA1c, that long Jan term marker was sen. My heart sank a little when I saw it. I told him, "Xiao Li, this is already pre-diabetes. If you don't make some changes very soon, the next step will be needing medication to control your blood sugar." This news truly terrified him. At just Senshitsi unmarried, the word diabetes conjured up images of endless needles, strict diets, potential vision problems, kidney failure, and dialysis. He immediately booked a follow-Jan-up appointment with me. During our consultation, I didn't immediately prescribe medication. Instead, I gave him 4 simple, actionable recommendations. First, reduce his usual portion of starches and replace at least half of them with whole grains. Second, make a habit of eating his vegetables before anything else at every meal. Third, the crucial one, after finishing his meal, don't just sit on the couch, get up and walk for at least 45 minutes. And fourth, to keep himself accountable, to record his meals and his walking activity, and to check his blood sugar levels monthly. The initial weeks were tough. That post-GAN lunch slump was so tempting. Instead of getting that urge to nap on his desk, he forced himself to go downstairs for a 10-minute walk. It felt awkward at first, unusual. But after about 2 weeks, he started noticing a difference. That intense sleepiness after lunch began to fade. His mouth wasn't as dry, and those frequent bathroom runs became less frequent. Then, at his 1 Jan month follow Jan Up, the results were astonishing. He proudly showed me his recorded logs and his updated blood work. His HbA1c had dropped from sen to nil. Looking at the report, I couldn't help but smile. "Xiao Li," I told him, "your blood sugar control is excellent. Now you're doing wonderfully. If you keep this up, you might even be able to completely reverse this risk." That moment of realization for Xiao Li was profound. He understood that it wasn't some unchangeable fate. It was about paying attention to those subtle post-Dan meal signals his body had been sending him all along. The subtle shifts in your blood sugar they often hide in plain sight, woven into the seemingly small routines of your day, particularly in those few hours after you've eaten. It's in that choice. Do you remain sedentary, scrolling on your phone, or do you get up and take a walk? That simple decision can be the difference between your blood sugar remaining stable or sliding dangerously towards diabetes. Remember this, diabetes doesn't develop overnight, and neither does stable blood sugar control. It's built through consistent habits, day by day, meal by meal. If you're seeing those 4 positive post-Jan meal signs, feeling alert, not overly thirsty, not needing the restroom constantly, and comfortably waiting until your next meal then you are on the right track. Keep up the great work, continue with your regular check Jan UPS, and never underestimate the power of small, consistent changes. Your future health truly lies within your own hands, starting with what you do after breakfast, lunch, and dinner. That's all for today's discussion. I hope this has provided you with clarity and inspiration to take proactive control of your blood sugar. If you found this information valuable, please remember to subscribe to the channel so we can continue to share vital health insights together. I look forward to seeing you in our next video. Until then, stay healthy, stay informed, and take care of yourselves.